70 to 80% of women will experience a perineum tear from birth, and yet the majority of those women will not receive a referral to pelvic floor physical therapy to address the scarring from that tear, which may lead to a multitude of pelvic floor dysfunction. Hi, I'm Dr. Ryan Bailey, and I am a pelvic floor physical therapist. I specialize in pregnancy and postpartum, and I want to go over one of the things that you can do to help with your scar tissue. Now, this one thing is a manual technique called scar mobilization, and it comes in many different forms, and I'm going to show you 3 different ways that you can begin with this. So to start, let's talk about the different degrees of a perineum tear. We have first degree tear, which is just the skin, very small tear, usually does not require any stitching. We have a second degree tear, which starts to go into the musculature of the pelvic floor. That one may or may not require stitching. Third degree tear is a tear all the way back to the anal opening, but does not actually go into the structure of the anus. And then a fourth degree tear is a tear all the way through the anal structures and musculature. Now, each of these can cause different forms of pelvic floor dysfunction. It may be leaking urine, it may be leaking gas or stool, it may be difficulty with penetration for tampons or cups, or with intimacy. And what we want to do is make sure that you have all of the tools that will help you minimize the impact of the scar tissue. So let's go over 3 scar mobilization techniques that you can use at home. Number 1 is first bringing your thumb or a tool like a wand, which I'm not going to show you in this video because I have other videos that show them, but using your thumb in a very comfortable position. So you may want to be in bed, you may want to be laying in a tub, and you're going to bring your thumb cleaned to the bottom of the vaginal opening, right at the top of the perineum. And the first thing that you're going to do is, with it resting just on the inside, so not fully inserted thumb, but just the tip of your thumb right on the top, you're going to pause and you're going to breathe for 5 breath cycles, allowing the tissue to soften and melt underneath the weight of your thumb. From there, what you can do is start to press down into the tissue. So instead of just letting it rest, you are actually going to press down towards the anal opening into the tissue. And then again, you're going to pause and you are going to breathe. Now, this press should not cause any pain above a 3 out of 10. If it does, you need to decrease how much you are pushing into the tissue. From there, you are going to hold it anywhere from 5 breath cycles to up to a minute. And you want to feel that the tissues are starting to soften and melt again underneath your tissue. I like to think about holding your thumb on a pad of butter, and the heat of your thumb really softens and melts the butter underneath. That's what the sensation that you're looking for in these tissues. Then what you're going to do is you're going to perform sweeps. So from side to side, if you picture this U-shaped bottom portion of the opening, you're going to sweep from one side to the next. So you're going to start off on either side. If you tore on one side versus the other side versus more midline, you can start off on the opposite side of the tear, which may be less uncomfortable for you. So again, you're going to not press very hard, if at all, and with a lot of lubricant, you are going to sweep side to side. Now, you are not really yanking on this tissue. You either are just laying the weight of your thumb or you are lightly pressing, keeping the discomfort under a 3 out of 10 pain and using a lot of lubricant so you are sliding and gliding really well. You're gonna go back and forth 20 times. If you cannot tolerate 20 times, do the amount that you can tolerate. Maybe it's 5 times, maybe it's 10 times. It's okay if you can't get to 20. You can work up to that. Then you're gonna gradually start to increase over time the amount of pressure that you are putting into that sweeping action. The last one that you are going to do is inserting your thumb so that you can hook onto the inside of the perineum, and then you're going to put your pointer finger on the outside. So you're resting on the inside and the outside, which holds the tissue between. Now you're not pinching really hard, you're just gently holding this tissue. From there, you are going to roll the tissue very, very gently between your pointer and your thumb. So you're rolling the tissue in between like this, back and forth. And again, you're not pinching, you're just holding and lightly rolling back and forth. Now you can do this at what is considered 6 o'clock, and then you can go off to either side at 5 and 7 o'clock and also roll, because your tear may be off more to the side than very, very midline. And we wanna make sure that you are on the scar tissue when you are doing that rolling. And you're gonna do that rolling 10 times at each spot, okay? Those are the 3 techniques that you can begin with. There are other techniques that can be done, but these are great 3 that you can start. If you don't feel up to starting with all 3, start with the first one and then gradually work into the other ones. Again, be in a position that is very comfortable for you to be in, where you can be nice and relaxed. You may even want to take a warm shower or bath prior to doing this work so the tissues are nice and soft and warmed up for you. You want to feel comfortable doing this work. If it's hard for you to reach this area, have your partner help you out so that you can get these tissues mobilized and make sure that you are addressing any pelvic floor dysfunction or reducing the risk of that pelvic floor dysfunction happening in the future. Ask your questions in the comments and follow along for more on postpartum healing.